Howdy guys, this is Dr. Mo's health channel. Today we're going to be discussing prostate cancer. In the last video, we talked more about benign disease of the prostate. In this video, we're going to be talking about prostate cancer. Now, prostate cancer is the commonest killer of men, black men in the whole world. It's the commonest killer amongst cancers in black males. In Caucasians, it's second only to cancer of the lung. So what is the prostate gland? Like in the last video, we talked about a small kola nut shaped gland which has 5 lobes through which the urethra passes unimpeded or unhindered, but which starts to become problematic after the age of 45 to 50. So the growth in the prostate can either be benign or malignant. And in the case of malignancies, there is a zone in the prostate that is called the carcinomatous zone. And that is the exterior part. The part that is closer to the urethra usually develops benign disease, but the outer portions of the prostate, which is usually left behind after surgery for benign disease, is what is mostly responsible for cancer. And so having a prostatectomy does not protect you against this form of cancer. So now, what are the presentations of prostate cancer? The presentation of prostate cancer are similar to presentation of benign disease. Prostate cancer presents with lower urinary tract symptoms, followed by upper urinary tract symptoms, as we discussed with benign disease. This will include things like hesitancy, urgent continence, or urgency, feeling of incomplete emptying, and all the other symptoms that we discussed under benign disease. There is also bleeding. Okay, so you might have blood in your urine. This also occurs in benign disease. Now, as the obstruction, if there's an obstruction, gets worse, you might also have symptoms like loin pain, and so when it begins to affect the kidneys. So how does prostate cancer present? This is one of the presentations of prostate cancer, so with lower urinary tract symptoms and upper urinary tract symptoms, plus bleeding. Another presentation that the prostate cancer may present is that it may present with these symptoms along with other symptoms like bone pain, bone in the hips, pain in the hips, pain in the ribs. It may also present with swellings on the skull, or it can present with unconsciousness and convulsions when there is spread of this malignancy into the lungs, to the brain and to the bones. So that's one of the other presentations. So a patient with lower urinary tract symptoms that has pain in the bones and swelling should raise the suspicion of having prostate cancer. Another presentation of prostate cancer is anemia. Okay, in which situation, what happens really is that cancer cells will have spread to the bone marrow and replace bone marrow cells, so that enough blood is no longer being produced from the bone marrow, and so the person may have unexplained anemia. So these are some of the commonest presentations. Occasionally, the patient will present with a lump somewhere and with no symptoms at all in the prostate. And in such situation, it may become a diagnostic conundrum. And only after a biopsy of that lesion is taken can it be localized to the prostate. So now, we have talked about the presentations of prostate cancer. Now, how do you diagnose prostate cancer? The diagnosis of prostate cancer, we can divide it into two. That is screening to detect cancer before it has occurred, and then diagnosis after symptoms have begun. Now, to screen for prostate cancer, it's advisable that after 50 years, men should visit their urologist at least twice or once a year to get checked for the possibility of a cryptic cancer of the prostate that can be caught early. In black men, it's advised that they start early from about the age of 45 to begin this. And the screening should start even earlier, at about 40, if there's a family history, or if there's a family history of any genetic disease that predisposes to prostate cancer. So depending on which category you fall into, you can start the screening procedure from between 40 to 50 years. Now, what does the screening procedure involve generally? It involves, one, doing a PSA. PSA is what is called prostate-specific antigen. When this is done in the blood, If the levels of the prostate-specific antigen are above normal, then there's a suspicion that the patient may, in fact, be developing prostate cancer. Now, PSA, the elevation of prostate-specific antigen, is not specific to cancer. It can also occur in infection of the prostate, prostatitis. It can also occur in benign disease. But the levels in cancer are usually quite high, above 10 nanograms per ml, 10 nanograms per liter. So when you have such levels, the surgeon begins to suspect that you may have some cryptic lesion there. And then he will now do what is called a digital rectal examination. In which case he will put his finger, his forefinger, index finger, gloved, well-lubricated index finger, into the anus of the patient. He feels the front, the anterior surface, for where the prostate usually protrudes. Now, if there is cancer, you have nodules, the bumps, much like you have on the surface of a rough lemon. Now, the surface of rough lemon is usually bumpy. Only one bump on the surface of the prostate is insufficient to arrive at to raise suspicion. But if the prostate is normal, it is very smooth, like the surface maybe of a lime orange, how smooth it is. Your finger just moves over it smoothly. So after that, if there is a suspicion of cancer, then a biopsy can be done, which is the next stage in the diagnosis of the disease. So what are the other investigations that you can do after, if you are suspecting that there is cancer? So the first thing you do is to do a prostate-specific antigen, and the doctor will look at the levels. If the levels are sufficient enough to raise suspicion, he will also do a digital rectal examination. Now, what are the other investigations that you can do if you suspect that a patient has prostate cancer? Both to diagnose and to know the extent of the disease, your doctor may request that you do a trans-abdominal ultrasound machine, so they can look at peep at the prostate through the abdominal wall. On the other hand, you can do a transrectal ultrasound where a cigar-shaped probe is pushed into the anus. This also will help the doctor to target site that is suspicious sites, unlike when you do biopsy blindly. The next thing that you are likely to do is to do your biopsy. And the biopsy, you usually do it with one long needle, what is called a core cutting biopsy needle, through the rectum. And therefore, you can get specimens of the prostate to examine. Now, there are other investigations that you can do, mostly to find the extent of the disease, whether it has spread to other parts of the body. So you can do a bone scan all the bones of your body to tell if there are any distant metastases. You can do a CT scan and MRI. That will tell you the extent to which the disease has spread locally within the pelvis. Now, when your result comes out and says adenocarcinoma of the prostate, that's how the pathological anatomist will report it. When he reports it as adenocarcinoma of the prostate, he will now try to grade it into whether it is aggressive, moderately aggressive, or not aggressive. There are 3 grades, okay? And there's a score for it. It's called the Gleason score. If you score between 6 and below, it's considered as non-aggressive. If you score 7, it's said that is moderately aggressive. If you score 8 to 10 on the Gleason score, it is said that you have a very aggressive tumor that is likely to advance rapidly. And using this Gleason score, the doctor will be able to determine what kind of treatment in discussion with the patient. Of course, he will be able to determine what to do. Now, what can you do when a diagnosis of the prostate, cancer of the prostate, is arrived at? The first thing that you can do is to do nothing. Okay, if you find a tumor that is still well confined within the prostate and has a very low Gleason score, okay, you might decide, okay, this man, or if the person is too weak to withstand treatment, or if he's too old and you feel that he is likely to die from another disease before he succumbs to prostate, there's no point putting him through all the suffering. So you just monitor him regularly to see if the cancer is spreading. If the cancer starts to spread, then you can treat. So that is acceptable for such patients. The other form of treatment that you can give to patients with prostate cancer is hormonal manipulation. Now, hormonal manipulation, what you do is that you give drugs that prevent the production of testosterone from the testes, because the growth of cancer is testosterone dependent. So when you give them drugs that can prevent the production of testosterone, then the tumor will tend to shrink. Now, this is one of the examples of this is Zoladex, LHRH agonist, partial agonist. Another group of drugs that you can use are drugs that act directly on the tumor, preventing testosterone from binding on the tumor, causing it to shrink. An example of that is bicalutamide. Now, having put the patient through hormonal manipulation, you may decide to do surgery. Okay, now there are two types of surgeries that are mainly done in prostate. The first one is in very early disease. You can do what is called a radical prostatectomy, where the whole of the prostate plus surrounding tissues and lymph nodes are removed. But this is only done when the tumor is very small and is still resectable. On the other hand, you can do other palliative surgeries like surgical removal of the testes or castration to help reduce the level of testosterone. That will shrink the tumor remarkably and prolong your life sometimes. Then you have radiotherapy. You can do radiotherapy. So the radiotherapy is either external beam radiotherapy, or they can put some radioactive rods inside the prostate through a special procedure, and it will be releasing ionizing radiation locally within the prostate, and it will help to destroy the tumor. That's called brachytherapy. You can also use what is called immunotherapy, which is using stimulants, things that can stimulate the immune system to attack the prostate gland. So they can stimulate the prostate gland, the immune system to attack the prostate. And then there's also targeted therapy, where for special cases, patients who have known genetic malformations that have predisposed them to that prostate can be targeted for treatment. Now, very interestingly, the treatment of prostate cancer, just like all forms of cancer, can be a very devastating news. And the first thing that one should do is that the patients will initially go into denial, but after some time, they will accept their fate. So it's very important that when this diagnosis is made, people, apart from the treatment, people should engage should be made to see a psychotherapist who will now tell him about the disease, why it is not necessarily a death sentence, and so on. And then you also have to teach the patient what is called coping mechanisms. The first thing is that the patient should learn about the disease, discuss it very well with the doctor, know the prognosis, know the various modalities of treatment that are available to him, know all the risk about it. You should read. In this modern era, you should Google. It should even be some patients, if they do that, they know more about the disease than the doctor. That helps them to cope. Now, it's also important that such a patient not to hide the disease from the family. Tell the members of your family so that they can help you, to support you, either financially, emotionally, or psychologically. Then another thing that happens to cancer patients that contributes to their early death is that they refuse to take care of themselves. They say, oh, what's the point? So still take care of yourself. There are some people that have lived with cancer for 10, 20, 30 years. There are people that have survived cancer. But if you don't take care of yourself or the other illnesses that you have, you might die from self-neglect and before the cancer gets you. The final thing that will help you to cope is another thing that can help you to cope is that you go ahead, if you still have the urge to have sex, you're having sex with your spouse, you will not transmit the cancer to her, and may keep you happy, and so that you just live